Welcome once again to Healthy Heart. This is Dr. Opoku-Asare. I am an interventional cardiologist and endovascular doctor. Thank you for joining me for another session, COVID-19 and weight management, which is a very important thing going forward, because I would like to discuss with you two major publications that came that has an impact on cardiovascular disease and as well as COVID-19. So what we seek to do today is to give you some updates about what has been happening in terms of the COVID-19 specifically, and then some publications that came out in terms of COVID-19. So why COVID-19 and weight management? The reason is this. Despite the controversies, the ongoing controversies about quarantine, and vis-a-vis how quickly we need to open the economy, both sides seems to be arguing one way or the other. A significant portion of the country is still under quarantine, and because of quarantine, people's physical activities have gone down. And in addition to people's physical activities going down, eating disorders are increasing because people are also eating more. Because you're at home, you open the fridge. Every time you open the fridge, you want to put something into your mouth. So we have a situation where people's weight may potentially become a problem. And what we are running into is a situation of energy disequilibrium. As we said, life is about equilibrium. I mean, we'll talk about ecosystems, we'll talk about things. When you disturb these systems, right, the human body is full of processes, and right from our birth out to this, it is a carefully planned, in my opinion, by the Almighty God, to ensure that things work well. Diseases and other things happen because the processes that are supposed to go on, they don't go on. So in the light of quarantine, we and most people, our physical activities have gone down. And in the light of the physical activity going down, the principle of energy balance, that is how much comes out of your system, that part has been reduced, whereas potentially either at best you've maintained your weight or your weight is going to go up. And that is why it is important. We don't want this situation. The reason why we're doing this series and trying to focus on COVID-19 is that we don't want the situation where after COVID-19, after the most states have opened up and you are coming out with cardiovascular problems. That is not something that is good. We want you to come out healthy, and emphasis on cardiovascular health, which is the number one killer around the world, whether poor, rich country, no matter the level. Cardiovascular disease is the number one in terms of mortality, that is death in men and women. And that is why it is critical and important that we talk about this. You see, things like pandemics that are occurring here, they will come and they will go. I strongly believe that this will go away. We as individuals, as a community and as a nation will get over it. But things like cardiovascular disease are usually chronic issues. And when it's all said and done and we have gone through this, these are the things that we need to deal with. And that is why it is important for you and me to be able to ensure that in terms of weight management, we are able to ensure that is done appropriately. So to give you a perspective about that, there are three components when we want to talk about weight management, or there are three indexes. Let me use that terminology. The three indexes that we deal with in most situations is essentially number one, that is the BMI, that is body mass index, which is your weight. What is your weight in kilograms divided by your height, right? That is what we know. And there have been numbers that have been published out there And I'm going to discuss with you something that is very, very interesting, that came from one of the biggest population studies that have been done. So number one is BMI. Number two is waist to hip ratio. Waist to hip ratio. So the concept of the waist to hip ratio. So let me put it this way. I want to split it. Number one is waist circumference. So that is the second index. So the waist circumference, it is not where you put your belt. No, it is not the place you put your belt, but it is the place, that circumference. If you measure your circumference around your belly button, right? How big it is a measure of your proper weight management. And we talk about a BMI of 25, less than 25 to be the one that we're looking for. We're going to look at it in a little bit greater detail today, and then we will going to look at the hip circumference. If you are a guy and then your waist circumference, that is, if you put a tape around your belly button and it's more than 40 inches, please, that is not a good idea. And then the last one is the concept of waist circumference, the ratio of your waist circumference to your hip ratio. So it means that if you measure your weight around your belly button and divide it by the weight where your belt is, if you're a guy, the place where your hip is, ideally we want them that the best place, we want them to stay as close as possible to each other. When your waist circumference is higher than your hip circumference, that means that if you measure yourself around your belly button and that is more than the area around what? Your hip, then that is also a marker of the fact that your weight management is not appropriate. So these are the three indexes that we look at in terms of what? In terms of your weight. So the concept here, once again, is not just how much should I weigh, but we look at your weight management in terms of these three. That is the BMI, body weight index. And then we'll look at what? We'll look at your waist circumference. Then we'll look at your waist circumference to your hip circumference ratio. And my hope is that at the end of today, I'm going to switch on to another topic. Meanwhile, go and get a tape and please measure it yourself. Then write it down secretly. Don't tell anybody. You know why? Because I was telling people that one thing that I've seen is that most people, not everybody, most people, they overestimate how much they exercise or how physical they are. And they always underestimate how much they weigh. You know, a patient sometimes come to me and they said, I thought I was going to weigh lower. I say, you don't need to think. There's something we call scale, right? This is not faith. You don't need to believe this is your weight. You can find out your weight. Things God has given to us to be able to do, we don't need to necessarily believe. We didn't necessarily believe that this is your weight, right? So the concept is that there is a what? There's a scale over there. So your goal in the COVID-19, let us put it this way, is critical and important. Number one, your goal is to get a scale and measure yourself. At least you know your height. And people ask me, when do I need to measure myself? The scale should be in front of your bathroom just before you enter your bathtub. That is the reason, right? Men and women can sometimes wear shoes that weigh like 5 kilograms or 10 kilograms. I have seen big shoes and I've seen big heels and other things. You can put on clothing and other things. So to avoid variability based on your clothing and other things, just when you're about to enter the tap, and I've not seen anybody enter the bathtub with a suit on or shoes on. So at that point, you don't have anything on, and that is your true weight. So it's not like you put the scale in the living room to measure yourself. There is a place that the scale is, and the scale should be what? Should be in your bathroom. Very, very important. Ideally, before you enter the tap. The practice of weighing yourself every day before you get into the tap. Just that practice. I've told people, do that just for 3 months and you will lose weight. because nobody can confront his weight day in and day out without doing something about it. It's a very simple and yet an extremely effective means of making sure that you control your weight. And you can make this decision, I'm telling you, make this decision that you put a scale down, measure your weight every day, write it down, and you will absolutely do something about it. Because nobody wants to look at their weight creeping up and they don't do anything about it. But if you consider continuously look at your weight, you measure your weight, then you will take steps to what? To ensure that the weight is appropriately managed based on some of the things that we talked about in terms of energy balance, how much you eat and how much you exercise. So we're going to come to that. Very, very important, because you need to know where you are. So know your weight from today, get your height, and then you'll be able to then make the appropriate thing. So let us talk about certain things that have come up. We had a whole discussion about weight last year, and you can go into that. So we don't want to repeat that. So let us look at certain principles here that are very important. And I want to start with a trial. You see, so let us come to a BMI. Your BMI ideally is supposed to be what? It's supposed to be less than 25. But there is an interesting trial that came to us that has shown us that something is even more important than BMI, and probably more important than waist circumference. Because people are putting up a lot of weight during this COVID era, and we don't want that, because weight gain is associated with a lot of problems, including diabetes, including all the things that are around. So I just want to discuss with you the PURE trial. The PURE trial is one of the largest epidemiological trials that is going on in the world currently. It specifically is coming from Ontario by one of the best research centers around the world. And in the PURE trial, specifically, this data was presented in a TCT, I think in a TCT last year. And it looked at 142,000 people in age from the age of 35 to 70, and from 29 countries. So this is what I like about this data. This data doesn't apply to only Americans. It doesn't apply to only North Americans. It doesn't apply to only Africans. It applies to the whole world, essentially. So they looked at 142,000 people in 29 countries, and they looked at their indexes, physical indexes, and they looked at their body mass index. And when they looked at their body mass index, they looked at their hip circumference. These are all the things that they looked at. And there is some data that came out that out of this, which is very important. What they did and showed over here is the fact that actually the best BMI, that is, if you divide your weight by your height, the number 25 is not the best. Actually, the number 27 seems to be the best. And this is something, this is not the first time, but increasingly we have an understanding that the BMI of around 27 may not be as bad as 25. So it tells you that nobody is going to end up crucifying you if you don't get a BMI of 25. From a BMI of 25 to a BMI of 30 is considered overweight, and a BMI of more than 30 is considered obese. So do your own calculation and see where you are, whether you are overweight or whether you're obese. But this trial showed us that probably 27 is not that bad. And the one thing that we want to talk about and show here is the fact that your body mass index has a U-shaped relationship. What does it mean? It is known that people also who have a body mass index that is low, very low, like 18 or below, they also have a higher risk of what? They have a higher risk of dying. So a very low BMI, that is, if your body mass index divided by your height is also too low, it's also not good. So being too thin is bad, and being too big is bad. And being right in between seems to be what? Seems to be the right thing to do. And it looks like this principle cuts across nations, right from North America to Asia to most of the places. This principle holds. You know, they even talked about the principle that, okay, the people who had low BMI may have been people. That means when I talk about low BMI, is less than 18, being too thin. It's important. They thought that, okay, these people may have cancers and other things, or they have conditions that were going to kill them. That's what caused that. They did an analysis and removed those ones, and it still persisted. So the golden number of BMI had always been around 18 to 25. But the pure trial showed us that probably around 27 is not a bad one. So it tells you that it's not all about BMI. Number one, some people, especially people who exercise, right, have exercising and building a lot of muscles. In somebody who is muscular, a BMI may not be a good measure of your weight management, because what is happening is that your weight is coming from the muscle mass. It is not coming from the fat. So BMI, though it is good, it may have a rough word. Its ability to precisely help you is not as accurate as possible because of the challenges in determining whether how much of your weight is muscle and how much of your weight is what? Is fat. And these are the limitations of a BMI. And that is why you should not use only your BMI. Because when I take an athlete or somebody who's a bodybuilder and is relatively short, that person may have a high BMI, but that is all pure steel. That is, I'm talking about muscles, right? Compared to the other person who does not exercise and is all full of fat. That though the guy who is exercising may be having a higher BMI, because his muscles, right? The BMI in that person is not reflective. And that is why there are other things that you can do. There's a test that sometimes you can do to determine how much, and that's what something that we're going to come to determine how much of your body mass, right? Your body mass is made up of muscle, and how much of it is made up of what? Is made up of fat. And your goal is to be able to deal with the fat, the adipose tissue, rather than what? Dealing with the muscle. You don't want a guy who has been training very hard, built muscles, or a woman who has been training very hard to build very nice, well-toned muscles, to stop exercising and then lose the muscle mass to be able to get into the BMI range. So these are some of the limitations of a BMI. So that is why we have things like what? The waist circumference. The waist circumference, I want to inform you that the waist circumference, as it has been found in other studies, is a better index of how much you are managing your weight. So the waist circumference, which is the circumference around your belly button, is much more predictive of what? Of your weight management than your BMI. And in the pure trial, they saw the same thing. The pure trial, as I said, is 142,000 people. They saw that in this study, your waist circumference is a better predictor of adverse, that is, bad cardiovascular things happening to you when you use your waist circumference. Waist circumference is important. Even in diabetic patients, right? Waist circumference across board, age and everything, the waist circumference is a better marker than what? Than the BMI. So don't just focus on the BMI. If your belly is getting bigger and bigger and bigger, that is not good. And you have to do something about it. It makes a lot of sense why the waist circumference is an issue. Why is the waist circumference an issue? Because hardly will you have a higher waist circumference that is due to muscles. Generally, as people get much more fitter, they develop six-pack, right? And you cannot have a protruded six-pack, right? I had the same thing years ago, right? So we call it a one-pack. Then you move from the one-pack to two-pack, then the three-pack. Then I can tell you the four-pack. I don't want to go into all those details. But there are certain chambers, chamber 1, chamber 2, chamber 3, and other chambers. That is not what we want you to do. We want you to have, if you can get it, the more your fat goes down, the more your waist circumference goes down. So begin to lay emphasis on your waist circumference. And as I said, if your waist circumference is more than 40, for a man, that is not good at all. And I can tell you, having 40 inches is not too big of an issue. It's not too difficult to have a waist circumference more than 40. It's very, very, very easy, believe me. I always tell people, look at the pants that you are wearing as a guy, right? If your pants is around 36, and if your belly, the level of your belly is beyond your belt, then you can think about the fact that your waist circumference is approaching 40. And if you are already having a pants of 40, then you will and your belly is bigger than where your belt is, then your waist circumference is high. So exercise tones down and gets the waist circumference down. So that is why anybody with a lower waist circumference generally have a lesser amount of fat compared to people with higher waist circumference. So that is what they show. And now we also talked about the third thing that we talked about is the waist to hip circumference. Ideally, you want this under good circumstances. You want it to be 0.9, right? Where your waist circumference, that is the belly button, is smaller than your hip circumference, where your belt is. But the challenge is for where your belt is for the men, but essentially everybody knows what the hip is. That is a big challenge in most people, but that is also a very good marker. So increasingly, you realize that it's not a question of just your weight. We have now moved from your weight to your BMI. And we are saying that beyond your BMI, there's a better index, which is what? Which is your waist circumference. The circumference around your belly button. Take a tape and do that. At least, when somebody asks you what is your height, you can tell them. When somebody asks you what is your weight, you can tell them. But take it from me, Dr. Opoku, I'm telling you this. That is not enough. When I meet you, I want to ask you, what is your hip, what is your what? What is your waist circumference? It's a better marker of your cardiovascular health. And especially if your waist circumference is increasing during this era, right? During this COVID era because of the quarantine, then you need to start taking steps to reverse it. Instead of having even a scale or something like that, you can measure that. And that can go a long way to be able to help you. Let us come to what they found in the Pure trial. They found something that we know. We had an idea about it, that it is even much more powerful than your weight because it relates to the muscle mass that you have. The muscle mass that you have. So it is a question of your strength. The strength or how much muscle that you have. And they had a simple test to see how much you can grab. And this is a measure of physical activity. And when they looked at these 142,000 people, the ratio of your strength to your weight is the single most important measure of your cardiovascular outcomes. Whether something bad will happen as a result of your weight was very much dependent on your strength-weight ratio. This is something that is new. This is something that is not, I wouldn't say this is something that is new, but this is something that has been reinforced. So how do people get the strength? They did a simple measure, how strongly you can grip something. And they what? And they divide it by your weight. And the higher it is, the better you become. Across board. So how do people get the strength? The strength comes from what? Physical activity. So number one, I tell people, irrespective of how much you weigh today, keeping yourself fit and engaging in physical activities, right, is going to go a long way beyond what? Beyond your current weight. And that is why you will be surprised that we're talking about weight management. Yet, strength to weight ratio is the most important thing. So, if you are not exercising, if you are not engaging in physical activity, and you are doing dieting, the so-called understanding of dieting. There are so many diets out there: keto diet, dada diet, kiki diet, all the diet there. And you are just trying to lose weight. I just want to advise you that that is not good. Because it is not a question of your weight. It is not a question of your BMI. But the most important thing is your strength to your weight ratio. And the higher your strength, the better you are. And your strength does not come from the weight that your strength does not come from the food that you are not eating. Your strength comes from the exercise that you are doing, and that is based on a pure trial. Let me tell you something here, for you to appreciate this. You see, there is something that we call frailty index. Frailty, right? You are frail. It's frailty index. How weak you are. We know that across almost all major cardiovascular surgery, the more frail somebody is, the higher the risk of the person dying, irrespective of the procedure that is going to be done for the person, irrespective of how the person is now. This principle of frailty index has been proven in people with cancer, right? Even in cancer patients, those who are more frail are going to go out. What is the essence of frailty? Frailty is a lack of what? It's a lack of strength. So the person, that is a very important concept here. You see, one person may have all the cardiovascular what? The cardiovascular. The person may have hypertension, diabetes, everything. If this person has what? Has higher strength at the time that you are seeing, compared to the person who has got no cardiovascular diseases, and yet has what? Has a higher frailty or what? It has a lower strength. That person that has got a higher frailty index or has a lesser strength, despite the fact that he hasn't got a diabetes, hypertension, and other things, that person will die earlier than the person who has everything yet has a strength. So this data from the pure trial has backed our understanding of how important having the appropriate strength when you are managing your weight. And that is why I will encourage you to do that. You see, fitness, you cannot dodge it. I want to go on and talk about certain things, certain practices out there in terms of the weight management that we should stay away from. Number one, never try to manage your weight with only trying to cut down how much you eat. Because we know from the National Registry of Weight Loss that when you combine people who combined reduction in how much they ate, that is their calorie restriction, with physical activity, these people were able to lose about 50 what? About 50 pounds of their weight, and they were able to maintain their weight for 5 years. And the same registry is out there for you to go and look at it. The same registry also showed us that the people who try to maintain their weight or reduce their weight by only dietary patterns, they were able to maintain only 10% of weight loss. Only 10% were successful. And they gained their weight back. So I call it the 90-10 principle. If you use only the food you eat, your success rate is 10%. If you use food and exercise, then your success rate is what? Is 90%. And that is why the three things that we've talked about, which is your weight, circumference, and physical activity, is something that you should put all of them together to be able to manage your weight. So I hope that all of us, I'm going to give you even greater details when I come back next week about certain specific components of the pure trial that are also important for us. The pure trial is a big population study out there, and we're going to look at it in terms of salt intake and other things. But I hope that this has been able to help you. So remember, the scale is important, your belly button is important, and then your strength. There is a very inexpensive way of testing your strength over your weight ratio, and I'll go into that next week to give you a means by which you can determine your strength over weight ratio, and that is going to go a long way to be able to help you. I want to end today with one of the studies that came out in terms of COVID-19 to be able to help us. So specifically on the 1st of May 2020, a New England Journal published one of the studies that I think it came back to reinforce what we said. So today I'm talking about big population studies. So they also looked at 169 hospitals and across Europe, North America, and Asia, and essentially they looked at about 8,910 patients who were in hospitals and they were discharged. I mean, either they were discharged or they died. And to look at what are the factors that in terms of the heart, in terms of the heart or cardiovascular issues, how did they relate to your ability to survive or not? That was very important. So in the data, they saw that 515 people died, which is the story that we know about COVID, that a majority of the patients will have no symptoms or mild symptoms, and most people will survive. But around 5%, the number goes to around 5%. So a total of about 5% of these people that ended up in the hospital, they died, and the rest were discharged. And I believe that the story is the same probably in current ongoing COVID-19. And they looked at the factors that were associated. Okay, if somebody goes to the hospital and he has COVID-19, what are the factors, especially the cardiovascular factors, that are associated with you either surviving or you either dying in the hospital if you end up going to the hospital with COVID-19? And this is what it showed, that for people that are more than 65 years, compared to people that are less than 65 years, remember that we talked about it some time ago. So this study came to confirm that discussion that we had earlier on, that the risk of dying whilst you are more than 65 years, based on this is not a randomized trial, but based on this observational trial, showed that your risk is 10% compared to somebody that is less than 65 years, whose risk is what? 4.9. So in simplistic terms, people that are 65 years or more have a 10%, have a double the risk of dying if they end up with COVID-19 if they go to the hospital. And we see that the risk is even lower for people that are 50 years when they end up with COVID-19 and going. And that is why it explains the guidelines, the national guidelines, that the people that must come out in the phase 3 are what, the most vulnerable. And these are people that are what? That are considered elderly, that is 65 or older. Another thing that was also found is, we've talked about it, is people with coronary artery disease. If you have got a blockage in the blood vessel in your heart, I cannot re-emphasize this. Once again, we talked about it about 3 weeks ago. If you have a stent in your heart, or if you have a doctor has told you that there's a plaque, there's a blockage in the blood vessel that goes to your heart, they also have a higher risk of dying. Specifically, is double the risk of dying if you go to the hospital with COVID-19 compared to people who don't have that. And people with heart failure, right? And people with arrhythmias, cardiac arrhythmias, these are the people with chronic lung disease, and people with smoking. So let me list the 5 things that this study showed. And this is a study across the nations that they did. They looked at. And the 5 things, number one, at least, number one here is age of more than 65. Having a blockage in your heart, in the blood vessels that goes to your heart specifically. If your doctor has told you that you've got heart failure, if you're a smoker, and if you have arrhythmia is atrial fibrillation, that is irregular heartbeats, right? Arrhythmia is the other one is COPD, that you have difficulty in breathing based on your lungs. If you have these factors, right, your risk of dying when you have COVID-19 is in most of these ones that we looked at, the risk is double compared to what? Compared to not having some of these risks. So let us look at certain things that were found. It's because these are important. There's been a lot of websites all over the place talking about the fact that some of the medicines that you are taking, if you continue to take them, they are going to make you die because we use, in cardiology, we use this medication to treat high blood pressure, to treat heart failure. These are the ACE inhibitors, and these are the ARBs, that is the lisinopril, enalapril, losartan, those medications. This trial showed that it is not associated with any harm. So once again, even as I've said it several times over here, the guidelines of American College of Medicine, American College of Cardiology, that is ACC, and most other societies recommend that if you're on these medications, please do not stop them. And that is why I want to come in here and sort of reinforce that fact. Another medication that people are on, which is cholesterol medication, specifically statins, atorvastatin, rosuvastatins, all the statins that people are on. Actually, it was found that people that are on statins, this is not like hard solid evidence because there's not a randomized trial. Actually, people that are on statins, that is cholesterol medications, they seem to have done better than the people who are not on what? The people who are not on the cholesterol medication. So please, don't stop taking your cholesterol medication. Don't stop taking your high blood pressure medication unless you've had a discussion with your doctor. Because at least, though we are not establishing a cause and effect here because this is not a randomized trial, we can establish an association that being on the cholesterol medication is at least not harmful and may probably be what? Helpful. And that is why you need to continue your cholesterol medication. And at least being on your high blood pressure medications has not been shown to be harmful even when people get COVID-19. So I would like to end today's discussion on COVID-19 and weight management, and specifically by saying that our inability to be able to go out and probably exercise as the way that we want comes with a risk of risk that we may be going into what energy disequilibrium with our weight going up. But let us take the measures that we've talked about. Please do well to measure your weight every day with a scale that is next to your bedside. That is number one. Also measure your waist circumference. It's a very important thing. When you want to report a better index of your weight, it's your waist circumference that you want people to know. And finally, please continue to exercise, continue to walk, and continue to keep yourself fit. because we know that the best marker of your physical characteristic is your weight, is not just your weight, but it is your strength over your weight, which is called the strength weight ratio. And the fitter you are, the better you are, irrespective of where your current weight is. So start the exercise, because every little step is a step towards better cardiovascular health. Thank you very much for joining us. I also want to thank our producing team. And if you have any questions, don't hesitate to give it to our producer, and we'll endeavor to answer them next week before we go on to the topic that we want to discuss. Thank you. God bless you. God bless America.
Thanks for listening to God's Rhythm. Tune in every Monday and Thursday at 10 a.m. Eastern Standard Time to learn how to protect your heart. God bless you.